morning, good afternoon, good evening po sa lahat. Saan mo pong panig kayo naroon. Welcome to our 230th episode of the Health Updates webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community, and to all those who have just discovered us today, welcome at sana po marami po kayong matutunan sa ating very important topic pero hindi po masyadong napag-uusapan. And I'm talking about corneal donations po, no? Yung imperative po na ma-address yung pong corneal blindness dito po sa Pilipinas. It really requires a concerted effort across everyone po, no? And really a whole society, whole of nation approach. Yung pong mga corneal opacities may be a result of trauma, may be a result of infection or other dystrophic processes. These represent significant po cause of visual impairment, and yung availability po ng mga malulusog or healthy na corneal tissue for transplantation, very, very important, very paramount para po ma-mitigate po itong disease burden na ito. So for this week, we will be discussing the intricacies of corneal donation from initial stages po ng identification of the donor, then screening, and then encompassing the stringent protocols to ensure that the tissue is viable and to minimize disease transmission, as well as other techniques in order to preserve and transplant na po ito pong mga cornea. We are very lucky today that we have our expert speakers to discuss the latest advancements po patungkol sa keratoplasty. So yun po yung pag-uusapan natin, and then offering insights ano po yung when is that needed, what are the surgical nuances and post-operative management po nito, no? But more importantly, I think we'll be addressing this socio-cultural set of considerations surrounding cornea donation within the Philippine context. How do we make it more publicly aware ito pong corneal donation po? No? How do we promote this culture of altruism? We emphasize the profound impact of this life-transforming gift, lalo na po doon sa mga mata-transplantan po, yung mga makaka-receive po ng mga cornea donations po natin. This is the Health Updates program, and I'm your host, Dr. Raymond Francis Sarmiento. Always a pleasure to be with all of you during our regular Friday, and also my pleasure and honor to co-host this program together with Ma'am Stella, Dr. Stella Maria Sen. Good afternoon, ma'am.
Good afternoon, everyone. Good afternoon, Raymond. Welcome to our participants here in the live broadcast of the Zoom webinar, and to all those watching via live streaming on TVUP YouTube channel, as well as the TV and the TVUP Signal TV channel 101. Our panelists for today are Dr. Beverly, alam mo, kilala ko siya with her middle name, De La Cruz, and Beng Rosa, she's now Beng Rosas, Beverly Rosas, and also Dr. Noel Carino. Our new program is now called Health Updates. We have done a little bit of reformatting for our program, but we are maintaining the same high quality and then leveling up to take a closer look at the existing and emerging health problems in the Philippines and in the rest of the world. So for 2025, we want to immediately get to the heart of the discussion. So our program is now only 1 hour shorter. So it's only for 1 hour. This March is considered the women's, it's the month for women. No? That's why our speakers are mostly females. Okay, so back to you, Raymond.
Thank you, Ma'am Stella. So as mentioned by Ma'am Stella po, we are still celebrating. March is National Women's Month. So for this month po, no, we want to be able to put a spotlight on one of the champions po for cornea donation in the Philippines. That's Dr. Beng Rosas. And also our reactor for today will be Dr. Noel Carino. Both of them are from Asian Hospital and Medical Center. And really excited to try to understand how we can all contribute to the let's say alleviation of corneal blindness and restoration po of visual function for those in need. So to set our discussion into context, as you know, we have our person on the street video just to gain the pulse of the common folks on the street po. No? Ano po yung pagkakaintindi po nila on the topic at hand. And the questions that we pose are as follows. May kilala po ba kayong nag-donate na ng kanilang cornea o yung kristal ng mata? Ano ang inyong opinion tungkol sa pagdodonate ng parte ng inyong mata katulad ng cornea at kayo po ba ay personal na papayag na i-donate ang inyong mata pagdating ng panahon? Please watch this.
I heard lang siya sa celebrity na yung before yung namatay, doon ko lang narinig yung pag-donate ng cornea.
Wala po akong kilala na nag-donate ng cornea po nila and yes, may idea naman po ako or may mga narinig naman po ako about it.
I think I've heard of it, but I don't know anyone who donated.
Oo, pero wala akong, narinig ko na yung procedure niyan, pero wala akong kilalang nagpa-transplant ng cornea.
I think, like any other namang organs, lalo na kapag, it will be helpful din naman sa tao. Agree din naman ako na makakatulong din naman siya sa talaga nangangailangan. Dahil syempre, malaking sacrifice siya, lalo na if you are still living.
One time parang nag-scroll ako sa social media and I read about it. Parang idea lang po pero not much.
Idea ko is that if person dies, say for example, if they have consented to donate, then it's possible. But I don't know the exact procedure and how it's done.
Hindi kailangan ng donor, tapos kung may available na, kung may kailangan ng cornea, kukunin doon sa donor, tapos iaano doon sa may kailangan.
Maganda rin po siya na gawin or like for me, parang I agree with the procedure na.
Well, not necessarily for that part of the eye, but I think in general, as long as there's consent, for example, I think it's okay.
Well, kung mapapakinabangan ng ibang tao, why not?
Pero I think pwede naman. Pero syempre, parang mas open ako if ever na hindi ko na siya magagamit. Like if ever I'm, dead slide, gano'n. Kasi syempre kailangan ko pa rin yung ay lalo na sa working, gano'n.
Yung husband ko, may pumirma na siya na kapag lahat ng functional organs niya pwedeng i-donate.
Yes, I'm willing to donate po if kung may chance for like kapag may kailangan, may mga nangangailangan.
Oo naman, para mapakinabangan ng iba.
Yes, absolutely. I think if someone could benefit from it, then I would be very much willing to donate.
Okay, that's a very heartwarming po. No? Thank you so much to our webinar team. Really pleased to hear na marami po ang interested or at least very willing po to be able to share and donate po yung kanilang cornea when the time comes, and something that hindi po masyado na pag-usapan. I think baka lang na on the spot sila, but we are very pleased to hear the affirmative responses coming in from our interviewees. Okay, just a little bit of housekeeping lang po no, before we dive into the webinar proper. All certificates of attendance have already been sent out. So the certificates of attendance is only given to those who watch at least 50% of the webinar duration. Now, if you have any questions or if you have any potential concerns po, no, maybe you need an edit here or there, please email us at our up.edu.ph email address. For our webinar today, we'll have a standard panel discussion format, and after our speakers have presented, that will be followed by a Q&A session. We'll get our webinar underway. Ma'am Stella will introduce po our main speaker for today.
I would also like to add that when you apply for your driver's license, at the back, there's always that question, if you want to donate your cornea. So wala naman hong masama doon if you check yes. You'll be helping other people also. So for today, our main speaker is Dr. Beverly Rosas. She graduated from the UP College of Medicine in 1989. She took her residency training at the UP PGH from 1990 to 1993, and she had her fellowship in Johns Hopkins University on oculoplasty in Hawaii under Dr. George Camara. Friends and our audience, let's welcome Dr. Beverly Rosas.
Hi Stella, hi Raymond, good afternoon and thank you for having us here. So, I think we should...
Yes ma'am, go ahead and share your screen pa.
Okay. Okay, so good afternoon, everyone. I'm Dr. Beverly Rosas, the chair of the Department of Ophthalmology of Asian Hospital. And I really want to express my gratitude to the organizers for inviting us here today. It is an honor to share our advocacy and the initiatives we have undertaken to establish our corneal donation program. Bagong Pagtingin, promoting a positive view on corneal donation. Bagong Pagtingin, giving hope for those with corneal blindness for better vision. So let's start with the basics. The cornea is a transparent dome-shaped structure, acts as a protective shield, and plays a pivotal role in the visual perception. Its light refracting property enables us to see and experience the visual wonders of our surroundings. However, the cornea can face challenges that impede its ability to fulfill its crucial role. Diseases, injuries, or congenital conditions can damage or cloud the cornea, resulting in visual impairment or complete blindness. In such cases, a corneal transplant becomes necessary. This surgical procedure involves replacing the damaged or scarred cornea with a healthy cornea from a donor with the goal of restoring visual acuity of individuals suffering from corneal blindness. Corneal blindness ranks among the top 5 causes of blindness, both locally and globally. Approximately 10 million people worldwide are in desperate need of a corneal transplant each year, yet only around 185,000 transplants are performed. In the Philippines, the number of transplants has significantly decreased during the pandemic from 500 to 800 per year to below 300. Fortunately, there has been a positive trend with the number of transplants increasing to 488 as of last year. However, there is still a scarcity of corneal tissue in our country, resulting in a backlog of several hundreds of patients awaiting transplants. For individuals with corneal blindness, a corneal transplant can be a beacon of hope, restoring their vision and allowing them to regain their independence and quality of life. However, we face a critical challenge, the shortage of corneal tissues. The demand for transplants far exceeds the available supply, leaving many on waiting lists for extended periods of time. This is where our collective efforts to establish a corneal donation program become critical. Let me share with you how we started our donation program here in our hospital. On June 28, 2017, a baby girl named Anyala was born in Asian Hospital. She suffered from a congenital disorder and only had a few hours to live. Her family, knowing this, wished to leave a legacy for Anyala and consented to organ donation upon her demise. Because of her age, only her eyes were eligible for organ donation. Anyala gave the gift of sight to Nikki, a 5-year-old girl with congenital glaucoma, a blinding disease if left untreated. It was a happy reunion when the parents of Anyala, the family of Anyala, saw Nikki and her family. Anyala's legacy served as an inspiration for our department to partner with the Eye Bank of the Philippines and provide eye and corneal donation in Asian Hospital. A memorandum of agreement was then signed in 2018. We aim to raise awareness, educate communities, and encourage individuals to make the generous decision to donate their corneas upon their passing. Despite the initial challenges and slow start that we had, we decided to persevere and signed another MOA in 2021. As a department, we rallied and proudly showcased our commitment to corneal donation, especially on social media. We held monthly roadshows in the different departments of the hospital, encouraging our colleagues to be corneal donors and spread the word to their patients. It is essential to forge strong collaborations with other doctors and with the hospital staff, especially the nurses. We recognize the significance of dispelling misconceptions and delivering accurate information about the donation process. To address this, we organized a series of lectures and talks. We collaborated with well-known artists in the music industry and had an annual event called An Afternoon of Music and Hope. In August, the Sight Saving Month. Sarah, Mateo, and Bamboo are our allies in promoting our advocacy. They help us reach out to a wider audience and gain momentum for our program pro bono. We extend our heartfelt thanks for their remarkable efforts. In 2023, we celebrated a Thanksgiving Mass to express our heartfelt thanks to the generous donors and their next of kin. It was truly a moving event, and we were delighted to have some of the recipients join us for this special occasion. The atmosphere was filled with deep appreciation and reflection as we came together to recognize the profound impact of our program on our community. It was indeed an emotional afternoon when we were joined by the Flores family, whose three siblings were affected by a congenital corneal problem. While two of the siblings, the two boys, had undergone previous surgeries, the youngest sibling had been patiently waiting for a long time for an opportunity to receive the necessary treatment. Thank you to our program and the dedicated care provided by their cornea surgeon, Dr. Pascual, the youngest sibling finally was able to benefit from the cornea surgery she needed badly. It was fitting that we ended the afternoon with an uplifting experience of music and hope with a captivating performance by Bamboo. We are filled with deep gratitude to Bamboo, our esteemed ambassador, who has made invaluable contributions to our program. Establishing a corneal donation program involves several key components that go beyond publicity. In addition to raising awareness, we have focused on enhancing the donation process itself. As part of our efforts, we have incorporated flyers into patients' admitting packets. These flyers serve to educate patients and their families about the importance of corneal donation and how they can participate. We have placed corneal donation cards in the lobby, our eye center, and set up corneal donation booths every time there was a hospital event. We created a corneal donation inquiry form. We feel that this is very important because of the sense of HIA that nurses and hospital staff in general, in terms of them talking to patients and asking them about corneal donation. So this form states that, do you wish to donate the corneas of your deceased loved ones as a legacy to help bring sight to the blind? And attach this to all the death certificates. This really made a big impact in our program because this allowed families to be aware of the opportunity at hand. In the notice of death form, we have included a specific section for cornea and eye donation. The nurse supervisor fills this up and indicates whether the deceased individual is a potential donor or not. These forms made our donation process efficient and streamlined. Upon the unfortunate demise of a patient, our team ensures that all necessary forms are completed. If the individual is a potential donor, then the transplant coordinator informs the IBANC, and the IBANC takes over. This efficient process facilitates the timely retrieval and transplantation of viable corneas. A simple tick on the yes box would initiate the process, informing the IBANC and eventually leading to the harvesting of the eyeball or the cornea. Lately, our nurses have been more comfortable and proactive about informing patients' relatives about the program, and this definitely has resulted in more inquiries and more donations. The eye bank is responsible for harvesting, processing, and evaluating the tissues. One eyeball or cornea goes to the nationwide pool of patients, and the other goes to Asian Hospital and is decked among the cornea surgeons of our department. The iBank operates two distinct programs. The first is the eye retrieval program, which is typically implemented in DOH hospitals with residency programs that have the capability to perform eyeball harvesting. The second program deals with hospital retrieval partners like Asian, where partner hospitals refer potential donors to the iBank, which then carries out the harvesting process. I am thrilled to announce that over the past 3 years, Asian has made strides in corneal donation. As a hospital retrieval partner, we have achieved a significant milestone by being the top-ranked hospital in terms of corneal donation under the program in 2023 and second to NKTI last year. It was a slow start and only one donor in the first 4 years. However, by establishing a streamlined program, we began and implementing the new forms, involving the staff and educating patients about the program. We have significantly increased awareness and acceptance of corneal donation. As a result, we have successfully received 26 donations and completed 10 corneal transplants at our hospital in the past 3 years. Our donors encompass a wide age range from newborns to 85 to 95 years old. Notably, two of our donors were newborns diagnosed with anencephaly, whose parents had pre-consented to donation before their birth. Our other donor cases included individuals with several or different medical conditions. In addition to the donors, we had 14 other potential donors who unfortunately did not meet the eligibility criteria. It is important to highlight this to underscore the fact that the program is truly gaining ground. Remarkably, a single eyeball has the potential to aid 5 individuals. The cornea, along with the sclera, that can be divided into 4 parts, benefits 5 people. The potential of our program to assist several patients is truly heartwarming. It is a testament to the positive impact we can make in the lives of those in need. This slide showcases a corneal transplant surgery performed under our program. It shows the removal of the scarred cornea and replacing it with the donor button. Here is the outcome of 2 surgical procedures done. Both have markedly improved post-op visual acuity from counting fingers to 20/40 and hand movement to 20/60. The impact of these transplants cannot be overstated, as they have transformed lives and allowed individuals to regain their independence once more. Our work, however, is far from over. The need for corneas remain high, and we must continue our efforts to raise awareness, educate the public, and cultivate a culture of donation. For this program to be sustained, we need to continuously promote it through social media, events, and campaigns so as to raise public awareness. We have to encourage registration of the public to be corneal donors by highlighting the positive impact it has and providing easy registration options. Hospital staff should be encouraged to integrate corneal donation discussions into their practice. Training our team to sensitively approach grieving families about donation is definitely needed. And of course, showing gratitude to donors and families, honoring their legacy, and sharing success stories of transplant recipients is essential. By implementing these strategies and working collectively, we can bridge the gap between supply and demand, hoping to reach our dream that every individual in need of a cornea receives the gift of sight. Now, let's address some commonly asked questions about corneal donation. What is corneal donation? This involves the voluntary contribution of one's corneas or eyes after death with the aim of restoring the vision of the corneal blind. This can be done by signing a donor card, expressing your intention before you die, or by the deceased's next of kin making the decision to donate. The procedure normally takes within 12 hours following cardiac death. Definitely, it is not disfiguring. When the cornea is removed, it is replaced with an eye cap that resembles a contact lens, and this maintains the integrity of the eyeball. In the case of eyeball donation, the orbit is reconstructed to prevent any facial disfigurement. Being a donor is easy. One can apply online, contact the eye bank or any hospital partners of the eye bank, or through the driver's license. Always have the card with you, and it's imperative that you inform the family. So when the time comes, they cannot say no, and they know that it is your wishes. Let us encourage others to be a donor as well. Unfortunately, not everyone can be a donor. There are several medical conditions that make the cornea not suitable for donation, specifically infectious diseases that may be transmitted through the cornea. Same with certain ocular diseases. The eye bank will determine the eligibility of the donors once referred to them. The identity of the donors and recipients is kept confidential unless both families agree to get to know one another. This allows the donor family to grieve and remember their loved ones without feeling obligated to establish contact with the recipient. And it also respects the recipient's right to receive the transplant cornea without any pressure or expectations. People ask often about monetary involvement. It is illegal to buy or sell human tissues or organs, so donors do not receive payment. Additionally, there are no extra costs for the donor's family. All expenses related to tissue processing are covered by the IBank and included in the processing fees. How can donation help the donor family? Leaving a legacy for their deceased loved ones usually gives comfort to the family. In Asian, the immediate family of the donor is offered free consultation by our volunteer ophthalmologist for life. Before I conclude, allow me to share the pivotal video that served as a catalyst for our endeavors.
Hello, I'm Bamboo, and I'd like to introduce the Corneal Donation Program of Asian Hospital and Medical Center. This program was inspired by the touching story of Daniela, who was born at Asian Hospital on June 28, 2017. Daniela was suffering from a congenital disorder and would only have a few hours to live after birth. With this knowledge, the family wished to leave a legacy for baby girl Daniela and pre-consented to organ donation upon her demise. Daniela passed away 14 hours after birth. Only her eyes were eligible for donation since all her organs were underdeveloped. Her mother donated them to the Eye Bank Foundation of the Philippines. Aniela's eyes were gifted to two fortunate recipients, and one of them is Nikki. Now, Nikki was diagnosed with congenital glaucoma, a bilateral blinding eye disease if left untreated. With the help of glaucoma surgery and the generous donation of Aniela's eye, Nikki can now see and is a very active and independent 5-year-old girl. Aniela is a hero. She has inspired Asian Hospital to partner with the Eye Bank Foundation of the Philippines. Now in its fourth year, Asian Hospital continues to advocate for eye and cornea donation. So let's be a hero to someone's eyes. Give the gift of sight. Asian Hospital Medical Center is one with the iBank Foundation Philippines in its advocacy for corneal donation. Be a hero in someone's eyes, the gift of sight, and be a corneal donor.
Together, let us embark on this noble journey, making a lasting impact on the lives of countless individuals and fostering a world where vision knows no boundaries. Be a hero, be a corneal donor. Thank you for your kind attention.
Thank
Okay.
you very much for your lecture, Beng. It was really inspiring, and I hope our audience appreciates the words of wisdom from Dr. Beng Rosas. What can you say, Raymond?
Yes, the very important work po, no? And thank you for making sure that this is front and center, Dr. Beng, and very helpful as well, that part of it, that there's also an appreciation from the celebrities din po, no? And trying to put a spotlight on this initiative. So thank you also to the Department of Ophthalmology from the Asian Hospital and Medical Center. We'll call you back, Dr. Beng, for the Q&A. Right now, we'll just make sure that we are greeting those who are joining us. No, we are joined po kasi by various different groups. Our avid viewers coming in locally lang po muna, the Department of Education Region Office in Bicol, in Legazpi City and Albay, the Department of Social Welfare and Development, Haven for the Elderly in Tanay Rizal, the Cebu Provincial Hospital in Carcar City in Cebu, Mayor Hilarion A. Ramiro Senior Medical Center in Ozames City, Misamis Occidental, and Eastern Samar State University in Borongan City, Eastern Samar. There are those also who are joining us from Los Baños, Laguna, from the University of Rizal System Health Services Unit from the province of Rizal. Maraming salamat po. From Bulacan Medical Center, Department of Pathology and Laboratory Medicine, thank you so much. From First Gen Corporation, thank you so much. And of course, those who are joining us internationally from Manteca, California, thank you. From University of Hail in Hail, Kingdom of Saudi Arabia, maraming salamat din po. The Ryan Hall Shanex Incorporated in Bridgewater, Canada. Chonin Hospital in Taipei City in Taiwan. And those others from Kingdom of Saudi Arabia po. No? Thank you so much to Dr. Abeng, who is also the chair of the Department of Ophthalmology. Right now, we'll call in po our reactor for today. He is a cornea and external eye diseases specialist, also from the same department, Department of Ophthalmology from the Asian Hospital Medical Center. Also is a partner at the Asia Pacific Eye Center and serves as associate professor at the University of the Philippines College of Medicine. Please welcome to your screens Dr. Noel S. Carino. Okay. Okay, shout out lang po sa West Visayas State University Medical Center in Iloilo as well. Please feel free to share your screen, Dr. Carino, and you can start.
Is my screen shared already?
Not yet, sir. Not yet.
Sure. Is it ready now?
Okay, there we go. If you can go to presenter mode and then we can start, sir.
Can you see my slides?
Yes, sir. It's the 2018 MOA signing.
Can I start now?
Yes, go ahead. Go ahead.
Okay. So good afternoon. I'm Dr. Carino. As mentioned, I'm the cornea specialist in Asian Hospital. So I'm just sharing here two photos which make me a little sad. So first, this is the first MOA between Asian Hospital and the iBank Foundation. So at the center of photo is Dr. Mengita Padilla. She is our cornea ambassador. She is the heart and soul of the corneal donation program in the Philippines. And at the background are Dr. Pascual, our chairman, our medical director. So what makes me sad about this picture is in 3 years, we had only 2 donations. And the second reason is, as obviously I have visibly aged from 2018. Now we go to our next photo. This is the next memorandum of agreement. Again, we have Dr. Mingita Padilla, our Chief Medical Officer. And I think the big difference here is Dr. Beng Rosa. She was my senior during residency, and she has this very persuasive personality that she will ask you to do something and you will do it even if you don't want to. So parang nabubudol ka ng konti, but at the end of the day, she comes up with the numbers. So these are the numbers. So recently we were invited to talk at the first donor summit of the Philippines in vegan because we were awarded for 2 consecutive years. Locally also in the hospital, we have here our CEO, CFO, CMO, awarding and recognizing the corneal donation program of the hospital. We have our non-cornea specialist, head of the corneal donation team, Dr. Rosas. We have been trying to come up with a phacoemulsification cataract package for more than 2 years, and it's never happened until now. But with the corneal donation program, the hospital was very supportive. They gave us a program which was more affordable so that we can do our corneal transplants in the hospital. If you go to the hospital and you walk around, you will see these tarpaulins of our celebrity corneal donors. You have here AJ Perez, and we have here Miko Soto, who unfortunately under demise, but fortunately for us, have donated their corneas and has made the program more visible to the public. We also have Bamboo. His posters are also littered in the hospital. And we have the full support of everyone in the hospital. So because of this, we have, tried to complete the circle, so to speak. We are now doing our corneal transplants in the hospital as well. So one of these operations that I had, the senior anesthesiologist, she was older than me. She asked me, parang small talk lang, Dr. Carino, you have a very nice corneal donation program in Asian Hospital. And then after, a quiet, so parang small talk lang. Then after a moment of awkward silence, she asked, Dr. Carino, who is Bamboo? Tapos sabi ko, Ma'am, don't you know Bamboo? You don't know River Maya? We didn't even talk about the songs Ulan, Elisi, kasi she had no total recall. And then after another awkward moment of silence, sabi ko, FYI ma'am, buhay pa po si Bamboo, baka kasi hindi nyo alam. So now I will shift to another part of this corneal donation program. The need for corneal donation is not only a very big impact on our patients, but also on the doctors as well. So the first corneal transplant was done in 1905, and little has changed of the technique until recently. So recently was 2002, Dr. Anwar published a new technique of corneal transplantation. So what he did was he put a needle into the substance of the cornea and separated the cornea into the component layers. And because of this technique, it has started a revolution on how to do, quote unquote, modern corneal transplant surgery. So when we talk about corneal transplant, you replace the whole cornea in toto, like a cookie cutter. But we have found out that, this is the alphabet soup of corneal transplantation. You don't need to know everything about it. But if you have, let's say, a component part of the cornea, which is diseased, such as a scar in the cornea, you can just replace the anterior part of the cornea, and then you can get better outcomes. If you have a disease affecting just the inner part of the cornea, which is we call the endothelium, it can cause swelling of the cornea or even Fuchs dystrophy. You can just replace the inner component of the cornea. Now, as you go down this technique, which have improved definitely, the chance of rejection is lower, astigmatism is better, recovery is faster, the use of steroids post-op is better, and the integrity of the eye is also more complete and stronger anatomically. So I'll just show here my transition, a few videos of my transition from doing the old method to the new method.
Sparing its normal endothelial layer. The procedure involves the following steps. Partial trephination of the recipient cornea to approximately 40 to 50% depth. The cannula is inserted through the pocket, and air is injected to create a bubble. The bubble is then perforated, leaving an intact decimus membrane. Remaining stroma is divided into quadrants and cut off, leaving a thin transparent.
Okay, did we lose him, Ma'am Stella? I'm not seeing Dr.
Oo na-stop in the middle of the OR. Sayang, exciting pa man din.
We'll just wait
Ginugupit
for
na.
him.
Ah,
I think so.
maybe
Dr. Abeng,
Dr. Carino is trying to
na-log
fix
out
this
yata siya.
There's some technical problems with Dr. Carino, but he will be on soon in a few minutes.
okay.
Sorry.
So
Okay.
we'll
We'll wait,
take
we'll
this
wait.
moment lang po no to just make sure that we've greeted everyone who we should have greeted lang po no, and there are those that I'm seeing also for University Santo Tomas magpapa-greet din po. Those are coming in from the Bicol region, from Quezon province also. So maraming salamat po. There are questions also that have been put in sa Q&A. And if you can also put in your questions here, dito po sa ating webinar chat, sa ating Zoom, or if you can put them in the comment section of the YouTube channel po natin for TVUP, as well as the comment section in the Facebook pages po natin that we also have, will be very much appreciative. We usually scan din po yung mga questions po ito, and then some of those questions also are phone-in questions or direct po na sinisend po sa amin. So please feel free to put in those questions. We really go through the entire list, and especially for those who are interested din po, no, how to become like a cornea donor. What are those questions that you would want to ask, like in particular, any support groups, kung meron man mga ganun po, and how is confidentiality preserved, those things will also uh, okay,
Yan,
we're
he's
seeing it on
back.
the screen. Okay, no, go ahead,
He's back.
Dr. Carino, with the video. Thank you, sir.
Donor cornea. Strips of endothelium. The suture like true corneal vaccine. Use the Lexo sponge to remove pigmentosus of corneal endothelium. Lens lines. Gently insert the endothelial ventricle into the anti chamber. Introduce air.
Dr. Carino, if you're talking, you're on mute, sir.
Okay, so this patient actually had a corneal transplant in the US, and we had to repeat the corneal transplant. So the patient was happy for a couple of years, and unfortunately, this cornea again rejected because of the rejection rate is higher when you do a complete corneal transplant. So this is a patient. He is a one-eyed patient. He had total retinal detachment and one eye because he is highly myopic. Unfortunately, they developed a corneal infection, and we were able to heal the corneal infection. We did an anterior keratoplasty because the cornea was only diseased at the anterior portion. And happy to note that after 10 years, this patient is still has a viable cornea. This patient has a bilateral corneal endothelial disease. The patient underwent cataract extraction under an excellent cornea cataract surgeon. However, eventually the corneas decompensated. So here we have one eye undergoing endothelial keratoplasty. You see a small lenticule here, but you don't see the many sutures. The other eye was waiting for a cornea. However, she had to go to Singapore and she spent 1.5 million pesos to have the other cornea done. And if you notice, the one eye looks better, though it was done here. And the main difference is if you wait a long time, the cornea tends to scar and the patient will have worse outcome. Another patient, bilateral eye disease, the patient could not wait for corneas locally. She went to India for both eyes to be done. And they have so many corneas in India. And she was happy to have both eyes seeing well now, though the right eye is not seeing as well as the left eye. So you have to understand, not only was the patient blind, the patient had to see me every month for contact lens replacement because she was in chronic eye pain. So what does the shortage of cornea have to do with us? The long wait makes scarring worse and the final outcomes are worse for the patient. Number two, there's also implications in training. Doctors don't do a lot of procedures, so the learning curve becomes longer. And patients or doctors in training also have less procedures. Consultants who want to shift are very hesitant to shift to the new method because of the learning curve. As mentioned earlier, graft rejection is 50% in 5 years when doing the conventional corneal transplants. There's also an implication in the cost. 10 years ago, the cornea processing fee would cost about 30,000 pesos. Nowadays, it costs 60 to 80,000 pesos per eye. So the less corneas we have, the cost of the eye bank is fixed. So we have more expensive corneal processing fees. So what are the action plans that we can offer? As mentioned earlier, you should take the pledge. You can write in your LTO that you want to donate all your organs. You can go to the eye bank and sign up a donor card. You just have to inform the next of kin that you want to donate corneas. As mentioned, yung buhay ang masusunod, hindi yung namatay. So you have to tell your next of kin that you want. Maybe an action list for everyone. If you are 65 or years old and above, or if you know someone who is 65 and above, I think you should have your cataract surgery done early. We don't want na mahinog yung cataract mo because the complications, including corneal blindness from a bad cataract surgery, is more common. During this campaign season, maybe we should avoid this quote-unquote free cataract surgery because if something goes wrong, they will not be able to fix your cornea. I would suggest just go to a good training hospital, and if there are complications, the training hospital, we will fix your problem for you, or go to a reputable center. And lastly, maybe we go back to Dr. Mingita Padilla. If you want to vote for her, number 27 on the party list would be a good number to remember. So that's all for my talk today. Thank you for your attention.
Okay, thank you so much, Dr. Carino. We'll try to call in Dr. Beng Rosas for our Q&A. And the first question will be coming in po from Dr. Stella.
I noticed that you mentioned that the longer the wait, the poorer the prognosis. Kaya lang, sometimes people are hesitant kasi. So, how do you go about that? That's
Well,
for me.
are you referring to what, cataract operation or the corneal transplantation?
Corneal transplant.
So
Kasi
if you're referring
oo.
to corneal donation, corneal transplantation, generally the doctor is already talking to the patient and telling them that the prognosis is bad if you wait for a long period of time. However, I think in our experience, it's not that the patient wants to delay the surgery. Maybe financially they will delay it, but it's because the waiting list, for my list, I would have probably 6 to 12 months for the patient before they get the cornea. Sometimes they fall through the cracks because we lose them, they don't follow up anymore. And when they come back, maybe it's too late to do a good corneal procedure, or we do the old technique rather than doing the newer methods of transplantation.
Thank you for your answer. You have questions, Raymond?
No, I think my
Meron yata
question.
sa floor. Meron yata from the chat box.
Yes, yes. So question here from Dr. Joseph Tortona is how many recipients can one cornea donation benefit daw po? But I also have a follow-up, but maybe we'll ask it to Dr. Abeng.
So because you have an option whether to donate the whole eyeball or just the cornea, the clear part of the eye. So if it is just the cornea, then you just have one recipient. But if you donate the whole eyeball, the sclera, which is the white part of the eye, can be divided into four. So you can benefit 5 people. So, but usually the sclera is not used for patching, for glaucoma surgery. So those are for oculoplastic procedures. No, so it's not always vision wise, but other functions of the eyes as well.
Okay. Thank you so much. Ma'am, the question that I have, and there are two people kasi who asked this separately. Really, how is confidentiality maintained in terms of that donor? Like, for example, if I guess their privacy concerns are they don't want someone knowing that it came from them or something. Panggaganon daw po.
It's
Obviously, patay na po kasi so afterwards. So,
Yeah.
how is that
Yeah.
maintained?
It's really only the eye bank who is aware who the donor is and who the recipient is. But there are times, like in my slides, you saw that the family of the donor and the recipient met. It's because both of them wanted to do so. So when that happens, the eye bank sets up a meeting between the two families. But it's only if they agree, both parties agree.
That's good. That's good. Okay, the other question daw ba naman po na that I have is all again coming in from multiple people is that malabo po ang mata ko. Matagal na po ako nagsasalamin. Din po yung kami. So, pwede daw po ba silang mag-donate na kanilang cornea kung malabo na daw yung mata po nila? Parang may makikinabang para po ba ng mata nila kung gano'n daw po?
Okay. Now, first of all, I want to correct the misconception that because there are some who would like to donate even if they're alive. Sad to say, there are people who approach us and say, pwede bang mag-donate pero isang mata lang? Thinking they could sell it to us. No. So that's a misconception that you can donate that when you're alive. This is the only organ that you donate that when you passed away already. No. Now, even if your vision is not clear, kahit malabo po yung mata ninyo, your cornea can still be donated talaga. No? Sometimes, if it will not help visually, there is also what we call the tectonic corneas. Like if you see, we had some donors who were 95 years old, and usually ito, hindi na function na for vision. But it's tectonic, meaning you use it for if you have a corneal ulcer, so you use it to patch that eye. But it's really not for visual function, but it still helps.
Okay. Okay, sana po nakuha po natin 'yon. So, hindi po ibig sabihin matagal na po kayo o makapal po ang inyong salamin, hindi na po kayo pwedeng mag-donate ng inyong cornea. They would still be very useful as Dr. Roses has mentioned. Ma'am Stella, on your end, any questions po?
No more further questions.
Okay, there are no more questions. Maybe I'll ask this to Dr. Carino. Meron daw po bang cost associated in terms of like from the donor side and then also cost associated on the recipient side naman daw po?
Cost. Well, there is called the corneal processing fee, which will include testing the donor, hepatitis, HIV, syphilis. So if the donor cannot get we cannot get blood from the donor, then that donor is not suitable for transplant. Sometimes we just use it for training purposes, and yung mga wet labs, we can teach our residents things, no? Now for the patient side, unfortunately, PhilHealth will not cover the cost of corneal processing, no? So there is a definite a number assigned to the cost of the processing fee. So the patient will just have to use the PhilHealth and maybe the senior for the professional and hospital fee. However, the processing fee at this moment, no, is still not covered. So siguro iboto nyo na lang si Mingita para masama na yon sa PhilHealth.
No. Okay, thank you so much, Dr. Carino.
I have a question for
Sige, go ahead.
Noel. So Noel, sa mga charity patients, how much should they prepare? How much money for a corneal transplant?
If we right now the iBank has decided that there are no private charity cases to be done in private hospitals. That's why we had to come up with a charity package. Dr. Lim Bonsiong and leadership have decided na how do we know you're getting free corneas but you're not charging your patients. So right now, with exceptional hospitals, we just do it in residency programs and training programs, and they don't pay. They just have to make sure they have PhilHealth and PhilHealth discounts, and they should not pay for anything except whatever incidentals are excess from the hospital fee. So PGH does a lot, and all the training hospitals, especially those with fellowship programs, we do a lot of corneal transplantation. So kapag meron tayong cornea, normally one cornea goes to the partner hospital and one goes to the national pool. So yung national pool, it's really the discretion of the iBank. Kanino bibigay?
Okay, thank you so much, Dr. Carino. So at this point po, no, we'll put in our evaluation poll muna. And thank you also to our experts from the Department of Ophthalmology from Asian Hospital and Medical Center. If we can have on the screen there we go. So it's 5 statements. It's a 4-point Likert scale. And we encourage everyone who is in here dito po sa ating Zoom to be able to answer this or read through it. We will not be closing it until the end of the webinar. So I'll go through it. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language or technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So, Ma'am Stella, what do we have for next week, ma'am?
For next week, we have Dr. Sibyl Bravo to speak on HIV, the mga updates on HIV. It's still Women's Month, and so we have very prominent speakers for next week.
Ayun. We're really looking forward to that one.
Thank you to our speakers,
Go ahead, ma'am.
Noel Carino and Dr. Peg Rosas.
Okay, thank you so much.
Together we can stop prevent.
Opo. So we'll ano po, no? So you can still watch us on the playback at TVUP YouTube channel, also at the TVUP Signal TV channel 101. So for those who would want to watch this, as mentioned po, all health updates webinars are archived for viewing at the TVUP YouTube channel. So you just go to the live tab. In the live tab, it will be 229 episodes, and after today, it will be 230 na po, no? So we encourage everyone to watch that. Also watch us sa TVUP Signal TV channel 101 po, no? Also, if you go to the same YouTube channel, which is www.youtube.com/TVUPPH, you go to the shorts tab naman po. Meron naman po the selected short presentations that we feature in snippets, and we hope that you can watch them at your convenience po, no? Very, very helpful. Maybe you can gain nuggets of wisdom from those shorts videos that we have. So this formally closes our webinar for the week. Magkita-kita po tayo again next Friday from 12 noon to 1 p.m. It's a date.
Together we can stop preventable deaths.
So keep safe, keep healthy. See you online.